Hi everyone. Many thanks for taking the time to attend this sedentary behavior conference organized by Karen and his group at Cardiff Med. For those who don't know me, my name is Arsalan. I'm a second year PhD student in sport and exercise here at the University of Gloucestershire under Simon, Louise and Karen's supervision. So in the next 10 minutes or so, I'm going to give you a brief overview of my research plan and present some key findings from the studies I've conducted so far. The primary focus of my research is to investigate, explore and compare the effect of prolonged sitting on cardiovascular and cerebrovascular health and just compare between pre and post menopausal women. Now, in pursuit of this aim, we've decided to conduct three studies. First, being a systematic review and meta-analysis, looking at the pool and synthesized evidence on the effect of prolonged sitting on arterial stiffness, and then follow it up with two experimental studies looking at the combined effect of prolonged sitting and menopause on cardiovascular and cerebrovascular health of menopausal women respectively. Now, in an ideal world, you would like to do this in a chronological order, which means doing the meta first followed by the experimental studies. However, life isn't perfect, and so was our research plan. So we have to cook something up. And when we started looking and searching literature for the meta, we have realized that there isn't enough literature out there to do a meta-analysis, which was quite frustrating, to be honest. So with my supervisory team, we have decided that we need to sort our meta plan with the first experimental study looking at the effect of prolonged sitting on central and peripheral cardiovascular function. So these are the three studies displayed on the screen, first one being the meta, the second and the third one being the experimental studies. So we have decided to go ahead with the second experimental study first, just coming up with it on the screen now. And the rationale for this study was very, very straightforward. Independently, both menopause and prolonged sitting heighten or increase CVD risk. However, their combined effect is not known. Given that women who are undergoing menopause and menopausal transition tend to sit more their younger counterparts and are already at CVD risk due to menopause, it would be really interesting and intriguing to see how these factors add together, or what is the additive effect of these two factors, that are prolonged sitting and menopause. And that comes to our first aim, which is whether prolonged sitting causes greater central and peripheral cardiovascular dysfunction in postmenopausal women compared to premenopausal women. So to address this, we have recruited 23 women, 13 pre and 10 post, who sat for 2 hours and underwent a bunch of vascular measurements, including pulse wave analysis, pulse wave velocity. We've also measured pooling in the lower limbs or lower limb venous pooling using NERIS. Now, when we try to analyze the data after getting it done with all the data which is available, we have realized that contrary to our expectations and hypothesis, there was no interaction of any sort for any of the outcome measures. However, for carotid femoral pulse wave velocity, there was an insignificant effect of growth, which means that carotid femoral pulse wave velocity is more in postmenopausal women than pre. Specifically, if you can see on the screen, the heart rate and the forward pressure here has a main effect of sitting. That is, in 2 hours of sitting, both these measurements significantly increased in both the groups. However, if we try to go to a conclusion, it specifically says that while postmenopausal women demonstrated greater overall arterial stiffness as evident by the increased carotid femoral pulse rate velocity, there was actually no difference in cardiovascular response to prolonged sitting, which is kind of neutral as far as our findings are concerned, but it is what is here, it is what it is, so we need to go ahead and do the meta-analysis. Now, as far as meta-analysis is concerned, the rationale again wobbles between the idea of doing prolonged sitting and arterial stiffness, measuring using flow-mediated dilation versus arterial stiffness. So if you try to look at what is already known, sedentary behavior heightens cardiovascular disease risk independent of physical activity. And sedentary behavior is also associated with impaired vascular function, specifically endothelial dysfunction, which we normally measure by flow-mediated dilation. However, the problem with flow-mediated dilation is it has low reliability, which requires high technical acumen to perform the measures. It's really time-consuming both to do the measure and then analyze it using other software such as Cardiovascular Suite or QPO or whatever. As an alternative, arterial stiffness as measured by pulse rate velocity is increasingly recognized in the past maybe 5 to 10 years as a surrogate marker of CVD incidence and mortality. But the problem is that there are only few trials which have investigated this association, and the gap in the research is that there is no pooled quantitative evidence out there to test this alternate marker, and that leads to our aim for this meta-analysis, which is, does an acute bout of prolonged sitting impact central or peripheral pulse rate velocity? And if we look at some of the interruption strategies, are they going to moderate this response? And we are right now on this meta-analysis. We've got 10 articles after our final literature search and trial selection. We are already done with the methodological study quality assessment. As you can see on the screen, the Cochrane risk of bias 2 tool, the one which we normally use to assess risk of bias. And here's this diagram which shows how we go along with our studies so far. And we are still painstakingly waiting for all the authors to get back to us with the data, which we finally got last week, and we are going to dive into the analysis so very, very quickly, and are really excited to look forward to these results. Alright, now let's see what's there in the store for the coming year. This actually brings us to the last leg of my research plan, which is the third experimental study, which is the impact of sitting on cerebrovascular function. So we are moving from the heart to the brain. I think the rationale is pretty similar to the first experimental study, that independently both sitting and menopause affects cerebrovascular and cognitive health. However, their combined effect is unknown. So the design is pretty similar. The rationale is similar as well. However, if you see its aim, we have an additional aim, which is incorporating habitual physical activity, which is displayed as HPA on the screen, prior to prolonged sitting, and whether this is going to impact the cerebrovascular and cognitive health in pre and post menopausal women or not. So this is one of the elements which we have decided to incorporate to see how this is going to work as far as the cerebrovascular health is concerned. Also, as you can see, all these 6 measurements displayed on the screen. So we are doing a battery of measurements this time round, adding it to our already existing cardiovascular measurements from study 2. So we are planning to do the cerebral artery velocity, specifically middle cerebral artery, posterior cerebral artery and anterior cerebral artery using transcranial Doppler. And we are really thankful to the team of Cardiff Med, as well as Sam's lab in Birmingham, who has lended us this transcranial Doppler instrument. And in the past I think 6 to 8 months, we have been trying to get this setup going, and we are now pretty much ready in the past few weeks to crack on this study, doing cerebrovascular reactivity using 3 minutes breathing of 6% CO2. We are also planning to look at the venous return in the lower limbs, putting the nearest device on the calf muscles, also looking at the cerebral perfusion, putting the nearest device on the forehead. We're also doing a small cognitive function test which says as TMT, or the Trainmate test. This is an alternate to Stroop test, which neuroscientists normally do, but it's just an alteration of Stroop test. And then active pal, as we all know, we are going to assess habitual physical activity status. And one of the things which we should have done in our study too, but we were not able to do because of the issues with the logistics, but this time we are planning to estimate the hormonal concentration using ELISA, the estrogen and the progesterone concentrations. So it's pretty much heavy and a huge number of measurements which we are planning to do in the coming few months, and let's see how we are going to come up with the results. That's pretty much it as far as 3 studies are concerned. And in a nutshell, if we just try to summarize, I'm really hoping that our findings will significantly contribute to the expanding field of research of sedentary behavior in middle-aged women, specifically who are transitioning through menopause, under the unified lens of both intracranial and extracranial vascular assessment. I think that's pretty much it what I'm going to say. I know it's quick, but I think we have covered most bits. So the house is open for questions, and I'll be happy to answer any of the questions which you guys might have. Cheers, thank you so much for your time.